Hello. Thanks to everyone joining us and for our presenters here today. I'm Tracy Flanagan. I'm Senior Director of Counseling and Advising at North Central Texas College. And we'll just go around here and let the other folks introduce themselves. And this is going to be a quick overview to let everyone know about Line Care, which is our new free telehealth service option for our enrolled students. So I want everyone to introduce themselves so you know who they are. And then we'll get going.
I'm Courtney Hymas. I'm the Associate Director of Counseling and Advising at NCTC.
I'll go. I'm Tracy Larison. I'm with Line Care.
Daisy, we can't see your face, but we know you're there, so we want to hear from you too.
Hi, my name is Daisy Garcia. I'm the Director of Equity, Diversity, and Inclusion.
And she's the one who makes all of our live stream events possible, because she is the master of ceremonies of everything technology related. So if you are a current student, so if you're currently enrolled for the spring semester at NCTC, you have access to Line Care, and in future semesters, so you will have access to the service. So if you're not yet a student, if you're not enrolled for the spring, maybe if you were here for fall or previous semester and you're not yet enrolled for spring, you would not access the services yet, but there's an easy way to remedy that. It's called getting enrolled in spring classes. So we had classes that started in January, obviously, but we have second 8-week classes that start in mid-March, and then we have Maymester classes that start in mid-May. So at any point, if you enroll in spring classes at NCTC, you will have access to Line Care. Our IT department sends over a report to our partners at Timely MD to give them an upload of all newly enrolled students for the current semester. So you're not going to miss out on it if you just didn't get enrolled in spring classes that started in January. So it will be an ongoing process to make sure our students, new, returning, have access to the service. So Tracy, do you want to say a little bit about it before I start sharing screen and showing our website and our resources?
Well, I'll just say that we are happy to be serving you all on the medical and mental health care side. It's the biggest thing to know about it is that it's 24/7. So we always want to remember that, that we're here for you, and they're going to go over how to get there and how to get registered. And then I can talk a little bit more about use cases and services.
Thank you. And we are also joined by Jennifer Burrows. She is also one of our counselors at NCTC. So Courtney and Jennifer are our two primary counselors that serve students across the district at NCTC. Obviously, we want students to have access to, mental health and Talk Now services, and to be able to connect with a live person whenever they need to, and us being human beings that work, 40 or so hours a week, sometimes more, but we're still limited in the amount of services we can provide our students. And we want to make things equitable, and we want to make those services accessible whenever they need them. So that's a big part of this partnership. And like Tracy mentions, 24/7, 365 access for our enrolled students. So I'm going to share some of our information here so you can see our Line Care site. So it's linecare.nctc.edu, which will get you linked to the linecare.care site where you actually set up your registration. So it's just as easy as entering your NCTC email address. That's how you set up your account, which is why you do need to be a currently enrolled student. So the services that are available, you have access to a telehealth appointment with a medical professional who can talk to you about, whatever symptoms you're having medically related. They can also assess for COVID-19 symptoms and talk to you about, should you be quarantining? Should you be getting tested? What do you need to be concerned about with any symptoms you may be having? Most, students are probably going to start with the Talk Now option if they're just stressed or overwhelmed and wondering, what do I need to do next? If they need to make an appointment with a licensed counselor, or if they need to schedule a medical appointment. So, the Talk Now feature, it's okay to ask for help whenever you need it. And sometimes you just don't know what to ask for, but you just need to talk to somebody. So that's really what Talk Now is. If you're not sure where to start, other than medical, knowing that, okay, I'm running fever, I'm not feeling well. Obviously, I've got something medically going on. I need to, do a telehealth appointment with a medical professional, a doctor. If you're just like, I'm not really sure what's going on, but I know I need to talk to somebody and figure it out. That's what Talk Now is for, to help get you routed to the appropriate service that you need, or to just talk through whatever's going on and give you a sense of relief where you feel like you know what your next steps are, even just managing anxiety or your time management or family relationships or balancing school, work, all of the things that you may have going on as a student. And like I said, you can have, appointments with a licensed counselor. So beyond Talk Now, you could actually have, counseling sessions via telehealth. And then we also have, through Lion Care health coaching. So talking about your sleep habits, your eating habits, exercise, wanting you to be, holistically, addressing all of your needs. So everything ties together, your mental health, your emotional health, your physical health, and that's where the health coaching can come in as well. And maybe you have limited resources in terms of the types of foods that you have access to. And you're like, with the type of food that I have, maybe I get some help from a food pantry, or, I only have limited funds to be able to buy enough food for my family. And I'm not really sure how to make, nutritional meals. And that makes a difference in terms of my energy level and my kids' energy level and our ability to be successful at work and school. So that could be part of that health coaching as well. The way students set up their access, and this access is also for our part-time employees and our adjunct faculty as well. So they have access to these same services as our students. But you're going to go to the lioncare.care page, and this is where you're actually going to activate your account. Hello, and it's not going to do that to you at all. Here we go. It didn't like the other link. So you'll sign in with your NCTC email address. And then this page gives you even more, frequently asked questions in terms of what you can be treated for. Talks about prescriptions, because if you do have a telehealth appointment, a medical appointment, you can have a prescription called into a local pharmacy, and Timely MD through Lion Care offers a free prescription discount card. So that is an excellent service as well. But again, all of these services are available to you, like Tracy mentioned, 24/7, 365. And these are free services, because as a student at NCTC, this is a service that we are providing for you, because we don't expect you to be a student if you can't, take care of your needs at a humanistic level in terms of your most basic needs, which is health, security and safety, food, housing. Those are things that you could talk, with Talk Now about too, if you're needing resources and you're needing to get connected to services that can help you manage stress and manage life. So we do have this information about Lion Care. If you are a student currently, or if you've been a student within the past couple semesters, you're in this All Students Advising group through Canvas, where we have lots of information about lots of different things for you to be successful, in regards to advising or navigating your major or getting connected to different resources. And we do have our Lion Care Timely MD information, located in this group. And we have a nice little demo video that we're going to watch.
Welcome to Lion Care. To get started, download the Timely Care app, no space, from the iOS or Google Play App Store. To register, enter your school email address. You'll log in and create an account with your information. Now that your account is created, you are ready to access care options. Press Start a new visit. Enter your location and select your visit type. You can choose from on-demand or scheduled options. Once you've answered a few questions related to your visit, you'll enter our virtual waiting room. Providers typically connect within 3 to 7 minutes. Once your provider accepts your visit request, they'll quickly review your case, and you'll be notified when they join the call. Press Join to get connected. Now that you're speaking with your provider, they can talk through your care plan and answer any questions you have, all over the phone. When your visit is complete, your provider will send a summary along with any treatment or prescriptions through the Messages function on the app. It's that simple. Download the Timely Care app today and visit lioncare.care for more information.
So Tracy, can you talk, and I'm going to stop sharing my screen right now. Can you talk some about when a student or, one of our faculty staff log into LionCare and their selection of providers that they actually get to see, make a choice about who they're going to talk to, for that service? Can you talk a little bit about that?
Well, one of the nice things is you'll get to read a little bio, kind of a snapshot about each one, what kind of medicine they practice on a right, whether they're, a family medicine. That gives provider details. It gives where I believe they're located, how long they've been practicing. So, and they write a little snapshot, hi, I'm Dr. Dennington. I've been in student care for 20 years. So you really have a lot of flexibility. I believe you can choose, you can scroll through obviously male or female. And I know there's certain even demographic, like religious affiliations. If you want to see a provider, then we can help with that. If you don't see it on there, and I was going to talk about this later, you can always call. We have a 24/7 800 number. If you have questions, even while you're in the visit, leave it on the screen, call that 800 number, and someone can answer any questions about your visit, your account, the services, anything like that. You'll get a live rep from Timely MD that works for us. So that's a nice feature too.
And you mentioned, gender preference or religious preference, and then there's language preferences are listed.
Yes.
In the options too.
Right. English, Spanish. I believe each provider would list, what language is spoken. So if there are other languages, it'll show those options on the provider.
And we do have, at least for our institution, we have a pretty large population that are dual credit and they're still currently in high school.
Yes.
So even under 18, they still have access to the services. Can you talk about how their family or their parents may want to be involved in how they're accessing their care?
Absolutely. They will have to, if you're under 18, you'll have to have a parent. Right now, it will be in the app in the next few weeks where the parent could log in and enter that information. Right now, the parent needs to call to that customer service number that's on the website. It's on the LionCare site. It's in the app on all of the pages. So you'll see that. The parent needs to call that number and get the visit started for you.
And then once they get the visit started, are they involved, let's say for example, counseling, are they involved in the counseling visits after that, or it's just initiating the counseling?
I think it's just the initiating, and then, the student, you'd be able to, take your mobile device and have a private visit if you like, but really it's they have to have that to be enrolled. So the parent is going to have to get it enrolled. Then when you want to schedule a visit, your parent doesn't have to approve the visit at that time. That by enrolling them, they're basically okaying them to have those services.
Right, giving their permission, but then their appointments would be confidential after that for
the behavioral health. Yes.
For counseling, yes. Yeah. And this is for students, they can access this, through the app on their phone, or if they're on a laptop or desktop that has a webcam, they can use that. Right. Or it could be
a tablet. It's only through the mobile app right now. The web-based will come later in the summer. But right now you have to have an app. So it would only be a mobile device, where you could download an app too. So
and they can't have a phone call. So let's say for some reason if they're they were having issues with their phone and they weren't able to connect with video, they can still have that visit via phone.
Yes. You can call that LionCare, that number, and they can connect. They can start a visit for you on the phone as well. And they can put you in the queue and do a phone visit. But you'll see in the app too, anytime you start it, even if you started on the app and you didn't want to do a video call, you just want it to be by phone. The video isn't a forced thing. You get to choose whether you'd like to see the provider or just talk.
Right. So that's good, because depending, connectivity sometimes is an issue with
Sure,
video.
yeah.
So, you know, I don't want any of our students to worry that, oh, if I can't have the video connection, that I
Right.
won't access the
That's
service.
just, you know, an added option for you to have that in-person video, especially medically when maybe diagnosing, you know, something in person.
Right. And Daisy asked a great question about if a student's in their final semester, maybe they're going to transfer or graduate, if they're going to be able to get connected to other resources in the community. If they're no longer going to be one of our students and have access to line care.
Right. You all have given us some great resources in the community that provider would then refer them to, or they may refer them, you know, back to you locally for, you know, my sessions are ending, I'm going to graduate, you know, what are some local resources if they're staying there locally, that you all could connect them to. But that provider on the phone has local information too that you all have given us, so they can give them as much as possible, and then we would probably refer them back to you for more specifics too.
Right. So we've given Timely MD in line care, we have given them all of the local resources that we have, including our contacts on campus. So, you know, like Courtney and Jennifer, our campus police, different people on campus that provide different services. So that way they know if there's somebody that they need to get reconnected back to somebody on campus, they know who to contact. So, so students aren't just, it's not just, I'm getting help through line care and then I'm never going to get support through NCTC in any other way with any resource. We're working together. So we're working as a team to make sure our students have, you know, everything they need, you know, as a whole support network. We got a couple other questions. So if the dual credit student is 18, so we're talking about the high school student, if they're 18, would they need parents' permission to access services?
They do. Yeah, they'll have to have the parents' permission anytime they want to get in and log in and visit.
And then another good question, besides language preference, do the providers show information in terms of LGBTQ? You know,
that's a great question, and I can get that answered. Probably not immediately, but I can find out, and you can put that on the Lion Care page.
Okay, great. Yes, because that is a very good question. We want students to feel like they have choices. You know,
I know you can request that.
Who they connect with.
I know you can request that if you're scheduling like an appointment, but as far as the on-demand providers, as far as who would be available right then, if they were, then I think that would be, you know, random. But I think if you wanted to schedule a medical or behavioral health appointment, you can request, you know, there's all kinds of requests in there, like request a specific provider. But I will confirm that, and that way you can put it on the website.
That would be great. I think, you know, these are all good. They're all good questions, and we want students to feel comfortable because obviously they're becoming more comfortable with doing things remote, you know, and distance because of, you know, the last year. But when it comes to healthcare and talking about personal things, whether it's physical health or mental health, we want our students to feel like, you know, they know who they're talking to, and they feel like there's a sense of connection there, so they can open up and share information that may be difficult to share.
Absolutely. And we want, you know, feedback anytime like this. If there's something from students, from faculty, staff, if anyone ever has, you know, something, they can, of course, talk to you all. But again, that Timely MD number is always open for any concerns, issues, feedback, support.
Wonderful. So is there anything that you think we haven't covered so far?
I think I will say we serve, and for you students to know, our providers have experience in student care. We are not just sourcing telehealth providers and mental health providers that, you know, have all different areas. They have had experience. They have a passion for caring for students your age, in your situation. They know what you're going through. And so we want that to be highlighted, because when you go on the app, it just, you know, lists providers, but they have experience in student care. So that's a big one. And that's a big differentiator from other telehealth services where there's millions of doctors, but none really in specialization. The other most frequent questions we get are if there's a question. That customer service number, I know you think about calling and I'm going to get put on hold and I'm going to have to go through 3 buttons, but it is a direct line. So if you are in your account and something isn't working or something doesn't look right, call that number and explain to them what's going on. Just switch in your screen, get out of, keep the app open, but go to your phone and call that 800 number, and a direct person will answer, so that you don't have to email, Tracy and her staff or someone else, or text a friend. Well, mine's not working. That number's answered 24/7 in the middle of the night. If you're trying to talk now and something's not working or not right, please call that number, because we can help you more than likely immediately.
And just a plug for making sure students are get connected in every way possible. If you don't already have the NCTC app, make sure you download that. That's free. That's for current and also prospective students. So, you want to download that NCTC app, which Daisy, again, the brains behind this outfit, she maintains the app and makes sure the information is always current, always relevant. She puts great information out there. So on your dashboard of the NCTC app, you have tiles, you have all of the other services that you need through NCTC. So you have the Lion Care, link there. You have Canvas, you have QList for signing in to any of the offices, and you have information about all the resources on campus. Daisy, did you want to say anything about the NCTC app? No, I'm hearing dogs. So make sure you download that app, and make sure, if you haven't already, activated your NCTC student email. Your NCTC student email exists once you're an enrolled student. So if you haven't activated it yet, that doesn't prevent you from accessing Lion Care. That email address is just how you activate your Lion Care account. But the important thing about activating your email is making sure you're getting communication with NCTC about anything and everything that's going on, and important information about your account, your schedule, any issues that may come up. All you have to do is activate it, log in one time, and you can actually auto forward your NCTC email to your personal address. So that way you're never having to log into separate accounts again. But make sure you set up that NCTC email so you get all of the communications from NCTC once you're an enrolled student, because that's always the address that we're going to use to communicate important information with you. So anything else that y'all can think of? It's just, we're really excited. This is a very big deal to be able to provide free telehealth care to our students. So it's something we've wanted for some time. And then after the past year, it's a necessity. Our students have been through a lot. Our communities have been through a lot. And we want to be there for them. We don't want you to feel like coming to school needs to be an additional stressor any more than it already is. We know college is difficult and it's a challenge and it's something that you have to manage. But we want to provide you resources to help you manage your life and your needs as a human being, so you feel like you can be a successful student.
I wish my school would have had this.
Right.
Your students are lucky. So that says a lot about how you feel about them. So.
Well, we thank all of y'all for being here today, and we look forward to our ongoing partnership and the ongoing service that we're providing for our students through Lion Care. So thanks, everybody.